I know, Dr. Saeed, that in your role as lead scientist and director of the National Laboratory, but also as a changing agent in the Ministry of Health, you have been pushing very much the agenda of working with the private sector. Tell us more about that.
As you know, like in Saudi, the government is doing the regulating, the financial and the operating, which is do it across the country. Cost in the lab services around 45% of 45% like wastage in the reagent and expiry and something like that. And transformation was like must to do it, to meet with the one of pillar of the vision of 2030, which is reduce the cost and improve the source of income for the country. And therefore, there is government initiated a huge company called Holding Co. and grouping the clusters, which is built by primary healthcare, general hospital, and linking to the specialized hospital or medical city. We did one trial first, which is in Riyadh, R2, which they call regional center clusters, and we connected around like 45 primary healthcare directly to the King Fahd Medical City, and we closed shutting down all the lab in this small primary healthcare. And what we found that there is reducing by 50% of the wastage. Before the budget of King Fahd Medical City themselves was able to run the service for the medical city and for the medical for primary healthcare, which is covering around like 35% from population in the huge mega city like Riyadh. From this point, it was like mandatory for to do the transformation, which is outsourcing all the lab, and financial is sent. Government will do it as insurance for the peoples, and they are only regulating and monitoring the work from their perspective. Therefore, at the moment, they are targeting huge and big names like in genetics, Centogene, Mayo Clinic, GC, and other labs to give more investment in the laboratory side. I'm talking only here about laboratory side. Also, like they are doing in the X-ray and other private. But yes, we found it is very helpful to have participation in the lab services, and soon we're gonna have like other branch like GC lab in Kingdom and Mayo Clinic. We're gonna have it in the Kingdom, which to have like participate and improve. We have as I told you, 63 story, which is in the pandemic. We bring the BGI help us in the screening, in mass screening, and we got to learn from this one to improve the participation and improve the financial wise and increasing the patient satisfaction, because what you build from this is building trust. The patient who is trusting the result is coming from this medical city or major city. This is good result, is good services, we're gonna get it. And you find more engagement is back from came from the community to this primary health care, changing your rule from doing just private and big hospitals to the community or community health systems. This is really improving and reducing the cost. And this is our vision.
One of the most important elements in that context is the pre-negotiation of the contracts, with as Professor Kazachkin mentioned, as an element of predictability and easiness in the relationship. You have to deal with the Ministry of Finance,
yes,
who has to deal with the budget law. So you are inserted in a legal and administrative framework that has to be prepared to do that. How did you find that? Was it easy to navigate these waters, or you have to be a little bit pushy? How did it work?
It's not easy. As I told you, we did this study before. We show him in the government how we improve reduce the cost for you. We running how many centers in same budget you give us for one hospitals. We show him the customer satisfaction, how improvement in turnaround time. This is like to explain your idea about go with the participation, see how centralize everything in one side, how is improving the financial wise, and then you have to like check your asset, how much costly, and then you're writing your tender requirement for the Ministry of Finance and other law to show him how you're gonna be send it for tendering and taking law approval to allow the private company to run service in public sector. Is still challenging. Until now, it's not in final approval, but we are in the right track to do it. So.
Thank you very much, Dr. Saeed, with these interesting comments. And let me come back to Professor Petersen on two areas, again, very incisive, and one of them is a particularly important and sometimes generating challenges and even crisis. This is about healthcare workers' security. In all these pandemics and the testing universe, could you give us some insights, some comments about that?
Well, if we don't have the healthcare workers, the system will definitely not work. And in my country, Denmark, 25% of healthcare workers were absent last week because of COVID, either because they tested positive or because they were a close contact and they have been placed in quarantine. So we are now changing our quarantine rules down to 5 days, and we release people from quarantine without a test if they are asymptomatic. But it just shows 25% of healthcare workers are absent. And we have had several nosocomial outbreaks with at least up to 50 people in one chain. And sometimes it is people coming into the hospital where the control procedures do not really work, especially with Omicron, or it's community transmission which is transmitting into the hospital. We have at present about 7,500 new cases every day per million inhabitants. So it's one of the highest incidents in the world. It's really testing and the logistics about having a rapid result communicated within hours that is one of the challenges here. And another one is surveillance. And I think that one of the things we have not really emphasized in this symposia here is that one of the competence and the new competence of running a lab is electronic communication with your end users, whether it's doctors or private people who need the result. Like I'm going to Romania tomorrow, so I got a PCR test yesterday, and at 2 o'clock in the morning I got the result electronically, both on my mobile and in my email. So electronic communication, and especially in healthcare workers, a very rapid turnaround time of your samples is very, very important. Another thing that you previously asked me about, Jeljo, is use of self-testing at home. I think this is one of the areas that will really develop. In the middle of the Omicron outbreak, we opened our schools fully the 6th of January. And we did it under the condition that the parents are doing home testing on the kids twice a week. So the government are providing free tests which the parents are picking up at the schools, and twice a week they will test the kids. And my granddaughter tested positive last week and said, I'm ill. No, I had a little headache, but that's all, and she's back in school now. So home testing, but also home testing, how do we register a positive test? It's also, again, about electronic communication back to the system, back to your lab. So a positive test in some cases at least will be registered, but maybe need to be followed up by a PCR test. So I think that rapid really focus on logistic and communication in healthcare workers, and the use of self-testing and, again, electronic communication to the authorities, to your healthcare provider. If you use self-testing, which I think we will do a lot, that is key in the future.
Self-testing as a tool empowering the patient, entering into a logics of effortless diagnostics, and helping the healthcare workers as well to manage their working situations.
Another thing I could add is that one of the things the laboratory perhaps could do is to offer training in self-testing for people who need it. I'm not sure all parents are really determined or know how to do a test on the kids, especially if the kid is sort of fighting against it. And in my experience, the kids are fighting against it. If the parents don't like to do the test, the kid will immediately pick it up and they will try to avoid it. And maybe training here in self-testing could be one of the topics we could pick up. So we say, yes, it's not that easy. No, none of us like it, but we actually have to do it. And I went self-testing with my grandchildren. They are 9. And now they learned it, so it went very well, but it's not pleasant.
Thank you very much. This is very interesting. Dr. Lee, all the panelists have been making their contributions and to the discussion from a public sector or international sector or academic sector point of view. You are the one who brings the private sector flag, in a way, being the president of a very important company in your country with a wonderful projection, internationally speaking. Can you tell us more about the way you managed to adapt the company to this interaction with the public sector, and how your company responded to that process?
I think through Dr. Goh said that through the lesson from 2015 MERS outbreak, the Korean government prepared the next pandemic. They defined the role and responsibility of public, academic, and private site. So established the response manual, so including emergency authorization system. Therefore, when COVID-19 came, Korea very rapidly responded the response to prevent the spread of COVID-19 infection. And the large private laboratories did their best to quickly expand facilities to enable mass COVID-19 testing, which is the big advantage over government agencies, so that the testing results could be released within 8 hours. And laboratories reported test results to KCDC every day, helping the government establish effective prevention policy tailored to the real situation. Yeah.